The most common cause of coronary artery disease is atherosclerosis. When we say atherosclerosis, we mean that there is a disease of the vessel wall resulting out of deposition of cholesterol, and this cholesterol deposition results in the formation of an atherosclerotic plaque, and this plaque over a period of time increases in severity and encroaches into the lumen of the blood vessel, and once it encroaches into the lumen of the blood vessel, it starts obstructing the blood flow. So the commonest cause of coronary artery disease is atherosclerosis. Rarely there may be some forms of congenital heart disease, some kind of vasculitis, that is inflammation of the blood vessels that affects the coronary arteries, and that can cause coronary artery disease. But most often coronary artery disease is because of coronary atherosclerosis.